I hear this question almost every week in my clinic. Robo's doing surgery? Doctor, will a robo operate on me? No, the robo does not operate on you. The surgeon does. The robo is simply an advanced tool in the surgeon's hands. Today, let's talk very simply and honestly about robotic surgery in gynecology, why it's trending and what it actually means for women. Why is everyone talking about robotic surgery suddenly? This is something that comes up very often. Once we clear the first doubt, the next thing people usually ask is, why are we suddenly hearing so much about robotic surgery? You might have seen in many reels, news articles and hospital ads saying robotic hysterectomy, robotic fibroid surgery, advanced robotic cancer surgery. Robotic surgery is trending not because it's fancy, but because today's women want faster recovery, less pain, smaller scars, better precision, and quicker return to normal life. And that's exactly where robotic surgery has made all the difference. Let's clear the biggest myth. And before we go any further, there's one very common misunderstanding that actually I would like to clear up here. A very important clarification. Remember, a robot does not think. A robot does not decide. A robot does not move on its own. We, as a surgeon, sit on the console and control every single movement that the robot does. The robot just simply translates my hand movements into an extremely precise action inside the patient's body with much better magnified vision and more flexibility than that of a human hand. Think of it like this. Just like your smartphone camera doesn't replace your eye, but it gives you a better, clearer picture. The robo exactly does that. It just enhances the surgeon's ability. So what makes robotic surgery different? So what exactly is different about robotic surgery? Let me break this down for you in very simple terms. First of all, a better vision. In robotic surgery, we operate with 3 dimensions. So it's a 3D view. Just imagine, wearing your 3D glasses and watching in the theater. It's a high definition, magnified vision. This means blood vessels are seen very clearly, the nerves are protected better when we operate, delicate tissues are handled much more safely. For gynec surgeries, especially cancer, endometriosis, complex fibroids, this matters quite a lot. The second thing is great precision. Now, the robotic arms can rotate and move in the ways that human wrist cannot. Now, why does this help? Deep pelvic surgeries in obese patients, repeated surgery when scarring is present. This has an important advantage. The third thing is less trauma to the body. So because the movements are very precise, the blood loss is less, the pain is less, the hospital stay is also shorter. Now, most women are surprised by how quickly they actually feel normal again. So let's look at some of the common gynecological surgeries that are done robotically. People often ask this question, where do we actually use robotic surgery in gynecology? Robotic surgery, if you look at, is commonly used for hysterectomy, which is removal of the uterus, fibroid removal, which is called myomectomy, endometriosis surgery, uterine prolapse repair, gynec cancer surgeries like cancers of the uterus, cervix, and sometimes in very early ovarian cancer also. Now, in cancer surgery, the robotic precision helps us remove the disease effectively while protecting the surrounding organs like the bladder, bowel, and also there is nerve sparing. Now, the question always is robotic surgery for every condition and for everyone? Now, at this point, I usually hear the same question from almost every patient. This is a very honest question, and the answer is no. Not every patient requires robotic surgery. Not every condition requires it. The decision depends on your diagnosis, your body type, whether you've had any previous surgeries, your overall health. So technology should always be chosen for the patient. It's not really for marketing. The right surgery is the one that is safe, effective, and it is tailored specifically for your needs. What patients usually ask also is that once surgery comes into the picture, the conversation almost always turns to recovery. So the question often asked to us is, Doctor, how soon can I walk? And usually it is the same day. So after the surgery, specifically when we operate in the morning, the patients start walking. The same day in the evening, they go to the restroom on their own. How soon can they go home? Most often it is within a day's time. Sometimes we also do it as daycare. The question is also, when can I return to work? Most women get back to their routine activities much sooner than expected. Of course, the recovery varies from patient to patient, but generally within a week's time, you're just back to your routine. The most important part, it's the surgeon. It's not the machine. And this brings me to something that I would always like to emphasize, especially in a longer conversation like this. I want to say this very clearly. Robotic surgery is only as good as the surgeon's experience, the team's training, a proper patient selection. Technology can never replace the skill, it enhances it. Always ask your doctor, how many surgeries robotically have you performed? Is robotic surgery the best option for my condition? These are very, very important. So it is the magician, it's not the wand that creates the magic. There's one simple takeaway that I would like you to remember. Robotic surgery is not about the robots. It's about the precision, the safety, the better outcomes, and the faster recovery for women. If you've been advised surgery or you're confused about the various options available, then have an open discussion with your gynecologist, because the best surgical decision is always a very informed one. If this video helped you understand robotic surgery better, do like, share, and subscribe. And remember, technology is powerful, but care and judgment always comes first.